Hi everyone, I'm Adriel Pineda. So what should I say? I did my BS at San Jose State and I did the CLS program as well. So I graduated in December 2019 with a BS in microbiology, and then I just finished the CLS program a couple months ago as part of the spring 2022 cohort, and I just started working as a CLS about 3 weeks ago, and I've been loving it, and can't wait to talk to you guys about
Congratulations.
it. Thank you, Michael.
So as we know, my name is Michael Bowling. I'm the program director of the CLS and CGMBS training programs here at San Jose State. My background is that I went to UC Santa Cruz. I was a biology major and I got out and I thought I was going to be working in biotech. And then I heard about CLS and jumped right into that. And I actually got a limited license to begin with in hematology. I trained at UCSF for a year there, got that license, worked at UCSF for about 10 years and decided, you know what, I'd like to have more options. So I went for the generalist license and trained at Stanford. And I'm still working there and it's a great per diem gig. I love it. It's a great balance with being program director here at San Jose State.
Awesome. Thank you for that. I'm so excited to have the opportunity to speak to you, Adriel. It is Lab Week, Medical Laboratory Professionals Week, so happy Lab Week to you all. I think this is a really awesome way to celebrate. And clinical laboratory science, I feel like is really a hidden career, unlike nursing or going on to become a doctor or any of those more patient-facing healthcare positions. So I think we have a great opportunity here to shine a spotlight on this career, which is, it does fly a little bit under the radar. So I'm so glad to have you and to have you tell us a little bit more about your experience going through San Jose State's CLS training program. So as you said, you did complete your bachelor's degree at San Jose State in microbiology. And when you were an undergrad, did you already know that you wanted to become a CLS at that time? Or was it a little bit later?
It was actually what I targeted for originally when I applied for colleges, but I wasn't sure about it still. But that was like my main goal at the time. I was still testing it out. Hopefully that would work out. And then so that's why I took microbiology because I knew that was the route to that was the most popular route to CLS at San Jose State. And when I took my first general microbiology lab and lecture with Dr. Scovrin, and I just loved the micro lab, and I said, okay, I think this is the right fit for me. I'm glad I didn't didn't just waste these first 2 years. But yeah, so I did have it in mind when I started.
Awesome. So kind of along those lines, somebody had submitted a question for you asking, did you have any work experience that was relevant to medical laboratory science before you applied, or no?
I would say my experience wasn't really directly in line with the exactly like a CLS type of lab. So I actually, after I graduated in March 2020, I started working at a dermatopathology lab. I was looking for any entry level jobs to get experience, to boost my resume for the CLS program because I knew it was really competitive. So I found a lab assistant job at a dermpath lab in Los Gatos, and although like the type of specimens we had, it was like basically a histology, but only the the dermatology portion of it. But even though it wasn't exactly the same like departments or same specimens as a lab that CLS would work in, I think just the fact that it was a clinical lab and we dealt with patient specimens and we worked with um, different groups of people and with doctors too, I thought it was I think that type of experience is universal for most clinical labs. So I think that really helped. Uh, it helped establish, it's important that we get accurate results. This is a patient. We're looking for skin cancer mainly at that lab. So I think that helped drill that into my mind early on. Things with patient privacy, HIPAA, and everything. working together as a team. So I think those things are universal at most labs. So although it wasn't exactly the same type of lab as a CLS would work in, I think I think it helped me a lot.
So would you say there were any particular skills, or was it more just what you mentioned just then that overlapped with where you're working now? Like, were there any things that you're glad that you had the opportunity to learn in that job that you feel like you are still doing today, whether that's a sessioning or that kind of thing?
Oh, okay. We did do some sessioning, and although we don't really do as much sessioning as CLS, I think at least at the Kaiser, it was mainly the lab assistants do that. I definitely had an appreciation for it because that a lot of errors happen, pre-analytically with things like accessioning or even like labeling, things like that, which we did do at my old lab too. So um, definitely showed the importance of that. But
Awesome.
in terms of lab skills, though, it was pretty different um, for the type of techniques we use as a CLS. But it's more of the general lab things that are universal that stuck with me.
That makes sense. Maybe Michael, you could weigh in on this. What kind of work experience do you feel like is really great for somebody who's interested in applying to a pre-CLS program to have?
Well, you asked the right questions about the accessioning. So for us, we like to see people with clinical lab experience just because the reason is that in a clinical lab, you learn some basics that are universal. And that would be not mislabeling a specimen, dealing with patients and multiple identifications for them, and pre-analytic errors and specimen suitability, and just appreciating again that samples will affect patients' lives, how you handle them, and also how you test them. So yeah, you will get the maximum amount of score, the highest score if you have experience in clinical lab, the highest score in the experience category. If someone's never had a job before, that isn't great as far as their score goes, but there's a number of other categories they could still hit it out of the park with to balance that. So definitely encourage some sort of lab experience, some sort of job experience. And yeah, that's it.
Awesome. So, Adriel, were there any undergrad courses that you took as a microbiome major that you feel like looking back were really important to what you're doing now, or things that were kind of covered in the didactic portion of the training?
I can name two off the top of my head that were pretty much spot on exactly to how it was taught in the CLS program. The first one is pathogenic or medical microbiology. That was the lab, especially the lab portion. It was pretty much exactly spot on what we did as part of the CLS program. In our micro training as well, it was identification, biochemical tests, things like that. Gram staining and everything. It was It was spot on. And the other class I think was exactly perfect for the CLS program. And I know these are prerequisites anyways, but the hematology lab was perfect too. I had it with Dr. Murray, and he had us doing manual RBC counts, manual WBC counts, things like that, blood smears, which are things I do still every day. So I think it was really helpful. It really, when I got back to the training for the CLS program and I did the hematology portion during the clinical portion, it just brought me back to those two labs, and I thought it was really helpful.
Awesome. Good to know. That makes sense that they're all the program prerequisites. So about the application process for you, how would you describe what that was like overall? What was your experience like going through the application process?
The application process. So I actually applied to both San Jose State and San Francisco State because I heard the program's really competitive. So I, wanted to increase my chances to get in anywhere. So although the two programs that have similar prerequisites, so you had to make sure you had all the right classes, all the prerequisites needed. You had to have a resume, personal statement, things like that. So I was working on that for a couple months beforehand. And all the info was on the CLS San Jose State CLS website. It's pretty clear what they want from you. So
Yeah.
I just took time to craft my personal statement, my resume, things like that.
For the personal statement, what kind of question were you answering for that? And for someone who's looking to apply, how much time do you recommend somebody set aside to really make sure their personal statement is getting across what they want?
I don't remember the exact question that the personal statement was asking. I think it was, what traits do you have as a CLS? Is that right, Michael? Or
Mhm.
what traits do you have that would make you a good CLS? Something
Yes,
like
and
that.
yes, and then also what your future goals are. Yeah.
Oh yes, the career goals, yeah. And for me, I think I took about a month on it. Spent a little time every day after work to work on it. Or I wrote a first draft in about a week, and then I had some friends and some of my coworkers look it over to see what they thought about it, see if they could have any input for me while I was editing it, and then yeah, that's pretty much it. About a month for me for my personal statement.
I think that's a great idea to have a couple people take a look at it and read it through. I love that point. That's definitely something I'll take and try to do as well. Um, so let's see here. How did you decide which programs in California that you were going to apply to? Did you just stick to the Bay Area programs, or did you kind of branch out and apply to the ones that are maybe in Southern California? Or, you know, there's a lot to choose from for applicants. So was it
Mm-hmm.
just wanting to stay in the Bay for you, or what helped you make that decision?
So I chose to apply for the San Jose State program and the San Francisco State program because exactly it was in the Bay and I live in San Jose. So distance was the first thing. At least for my first try, I was going to just do those two to see if I would get in, and luckily I did, because I thought it would make sense. Just financially and logistically, I don't have to move. I still live at home, so it really helped a lot with finances. And I didn't have to pay for rent. Luckily, because my clinical site was a local clinical site, so it worked out for me. And that was the main reason. It was honestly distance, and then which also helped in why I chose San Jose State, also because of the distance and clinical site. Um, it would just have the least impact for me, with work-life balance, not having to do a long commute or anything. Uh, yeah, because that would impact my, performance for school and everything. So those, but if I didn't get in the first try, I would definitely expand to the Southern California ones, or I think UC Davis has one too. There's a list of all the California CLS programs, and I would have just expanded to more of them to see.
Awesome. That makes sense. So when it came to the site ranking process, how did you go about doing that? Did you, from what I understand, applicants are able to kind of choose a number of sites that they, from what they would most prefer to least prefer, and then they're matched with a clinical site from there. How did you choose, and did your lab tours play into that? And if so, what were you kind of looking for from the labs you were interested in?
So another big thing was, again, distance for the clinical sites as well. But besides that, and unfortunately, so during my application or during my interview process, it was towards the end of 2021. So COVID was still really had some strict guidelines. So actually, the majority of my interviews were on Zoom. So it was kind of hard to get a feeling for the lab um, without visiting in person. I only visited about 2 or 3 labs in person, one in Reading and Oroville, and I think I'm missing one more. But so I really tried to ask the interviewer questions about their lab. I was mainly looking to see what type of environment they had, the size of their lab, if people there had more teamwork, or if they had more individual, like you're at one bench the whole day, or do you move around? Are you more of a generalist? So things like that. And luckily, the clinical stuff, I base it off not only distance but also if I felt like I would fit in that lab. because there's an expectation. Most of the labs have an expectation that they're spending a lot of time and money on you to train you, and there's an expectation to usually retain their students. So I really tried to think ahead and see, oh, do I see myself working here afterwards? Would I fit in? Even not just for working, even for training, would I be able to get trained here with this type of lab environment? So that's the main. Those are the main things I was looking for, and those are the ones I ranked first. So it worked out.
Awesome. I think that's a great point. So you wouldn't necessarily choose to uh, complete your clinical training at a very remote site that you actually wouldn't want to stay at. So you were really looking for kind of a lab that you wanted to continue on at. And you also mentioned that's the expectation of that lab too.
Yeah.
Sense.
And it's not only, but even if it was remote though, I still ranked the majority of the sites because I still really wanted to get in the program, because at the end of the day, if I still don't get my preference, I still want to be able to get through the program, get my license. And even if I did have to stay at a remote site for a few years just to work there, I was willing to do that too, and then move somewhere else if I wanted to, because I knew it was a really competitive program. So any chance I would get, I would definitely take it. But everyone's needs are different, so it's up to you, really, your personal preferences.
So just to wrap up, questions about the application process. Was there anything else that kind of stood out to you about your experience with it, or anything else you want to share?
For the in-person tours, I really love the in-person tours. It was great to meet all the CLSs. Everyone's super encouraging, not just through the interviews, but even through the program. Everyone's super encouraging. Everybody wants to train you because there's a CLS shortage right now. So everyone's enthusiastic to have these students to which is possibly future employees. And I just really enjoyed seeing the different labs I got to see. I did a few in-person tours at San Francisco State also. So it was cool to see different lab environments. They're really different between them. Some hospitals are really big, almost like a reference lab, huge lab. Some hospitals really small and had only maybe 1 or 2 CLSs per department. And there's such a wide variety. And I thought that's what stuck out the most to me during the interview process, the hospital clinical tour process.
So you could be potentially placed at a very large hospital or a smaller hospital. All these sites are part of San Jose State's program. So when you were matched with Kaiser, what kind of hospital is that? Is that a large facility? And were you only training at one particular hospital, or did you kind of have to commute to different hospitals, part of Kaiser, for different parts of your training?
So Kaiser is a very interesting way they set up their lab. So Kaiser San Jose itself, which is the one I was matched to, they're a pretty small lab, relatively probably to most hospitals, because Kaiser they consolidate some departments at a regional lab. So Kaiser has a regional lab for the Northern California Kaisers in Richmond and Berkeley. And for our training, we did have to go for about 17 weeks, about 4 months, a little over 4 months. We were in Berkeley for the departments that aren't at the hospital. So none of the Kaiser hospitals have a major microbiology department, mycology, parasitology, immunology, and special chem. They were all in Kaiser Regional. So for about 4 months, my Kaiser classmates and I, we were commuting there together. Our schedule, they usually pair the Kaiser students together during your time at regional lab, Kaiser Regional Lab. And so that was a big reference type lab where pretty much all of Northern California Kaisers send their specimens for those departments to those labs. So it's huge. There's so many CLSs in one area. There's no patients that go there. So super different environment. I thought it was a great experience. There was a COVID lab. There's a COVID lab there in 2021. A lot of COVID testing was happening. So they had a dedicated department with about a little over 10 CLSs just doing COVID testing. Wow. So that was a cool experience. And then when in July we got back to Kaiser San Jose, it was a really small lab. More everybody there works as a generalist, versus at Kaiser Regional Lab, you are assigned to a department. and you only work in your department. And here at Kaiser San Jose and all the Kaiser hospitals, we only have hematology, UA, chemistry, blood bank. But everybody, all the CLSs there, they work all departments, so they're doing different departments every day at work. So when it comes down to choosing your where you want to work, I think that's plays a big role too. But yeah, so yes, I did have to commute to those two places. Once in Berkeley, and then one at my main clinical site at San Jose.
This is where the send out cultures are going.
Yes.
Some of you may not be familiar with the different departments of a clinical lab. Could you just briefly describe what those departments are and what these would be the departments that you rotated through during your training? Is that right?
Yes. So should I list them out? Is that let me, hopefully I don't miss anything, but there's microbiology, which includes bacteriology, mycology, parasitology, virology also. So mainly bacteria, molds, infections, streaking plates, just like microbiology class pretty much, like an undergraduate. So there's a micro department you do rotations in. There's urinalysis, which is just testing urine. There's a blood bank or transfusion. So you're handling blood and other blood products that'll be transfused to patients that need it. So you'll be handling all the, blood typing, blood testing, making sure units are compatible with the patient. Chemistry, which is a whole huge department with many different chemistry tests, from glucose to liver enzyme tests. There's a wide variety, cardiac markers, things like that. What am I missing? Oh, there's immunology, a lot of molecular tests.
So there's such a broad range of departments and so many tests that you're faced with, that you're tasked with learning as a trainee. I mean, I can imagine that would feel pretty overwhelming. So how are you being trained to perform the testing in each department of the lab when you first begin your weeks that you're going to spend in that department? Are you kind of shadowing a fellow CLS at first, or how does that work really?
Yeah, so usually you would be shadowing a CLS, and they'll usually be explaining to you what they're doing. They'll also probably have you read the SOPs of the tests that they're doing, so you understand the process of what they're doing. So after some shadowing, they'll slowly start to have you do some tasks, maybe help them out, until to the point where you're doing it basically by yourself, but although supervised with the CLS. Yeah, so slowly progressing from watching, shadowing, to you doing the tests themselves, and then yeah, the whole process like that. For every department, it was pretty much like that. Some of our departments had us, especially at regional lab in Kaiser, we had their microbiology department. They had us actually, some trainers gave us lectures, small lectures, and they had us do unknowns, micro unknowns, to identify using the tests they have over there. So I think it would depend on the clinical side too, what type of, how their training would go, but that's how it was for me at Kaiser.
Okay, so the structure might vary a little bit depending on where you're training, but just to back up a little bit, can you describe how this training year is structured for anyone who might not know?
Sure. So we had 3 semesters. Is that right, Michael? 3 semesters total in the program. And we pretty much went through one department at a time. Well, one topic at a time for lectures. And then at the same time, while that's happening, we have your clinical training schedule, which you'll be doing one department at a time. And not these two won't necessarily line up. That's not guaranteed. The majority of mine did, but there were some cases when I was studying something else for a lecture, while also learning, maybe having my first exposure to a department at the clinical site. So it was pretty interesting having to juggle 2 things, but honestly, I think it helped reinforce it actually when I didn't have them synced because for example, when I was learning something in lab, like I think urinalysis, I didn't have it yet in lecture, and then when the time I had it for lecture, I had a pretty good background about it, so it was almost like having a second refresh. So it was nice to have the topic reviewed twice to me when I didn't have them in sync, which is I thought was pretty interesting. But for my microbiology, I had them synced, and it just depends on your clinical site if they're synced or not. But you just go one department at a time through lecture and one department at a time through the clinical site
So
throughout the year.
lectures in person, or did you
Oh,
do those through Zoom?
lectures were so the San Jose State portion was completely online. Everything was on through Canvas or Zoom. Some of the lectures, I think the majority of lectures were pre-recorded videos that were in modules on Canvas. But we also had a little over a semester that we had live Zoom lectures for blood bank and a few others. So just between pre-recorded lectures on Canvas and live Zoom meetings. So no in-person classes.
Okay, so kind of like a med school style, similar to that. I'm curious which departments that you were trained in did you find the most challenging, which were just really involved a lot of difficult material, and then conversely, which ones did you just absolutely love and you love when you're working that bench during your week?
So the hardest for me personally was chemistry for both the lecture and the clinical portion because I'm not sure if I don't remember how it was at San Jose State for my undergraduate, but I don't think we didn't have a clinical chemistry, or at least I didn't take clinical chemistry. So that was my first exposure to the clinical side of chemistry. I've only seen like organic chemistry or just regular lab chemistry. So all these tests were so new, and there's so many different tests with so many different things to memorize. So it was pretty overwhelming to me. So that was my biggest struggle in the program was the chemistry. But and on the other hand, my favorite departments. As a micro major, I love microbiology. That was my favorite during the training when we were at regional lab. We had exposure to pretty much every bacteria out there. Mycology was cool. For the tuberculosis, for the acid fast bacilli department, we had a experience, in a PAP. We had to use a PAPR suit, full positive air pressure. That was probably the most intense part of the training, but that was my favorite. I love microbiology. Unfortunately, because I'm at a Kaiser hospital, we don't really have a big microbiology since we send everything to regional lab. So I don't really get to see that too much in working now. But my second favorite is hematology. Shout out to Michael. He was our hematology lecturer for during the program. I love hematology. I love the lab too when we were undergraduates. Even though most of it's getting pretty automated, there's still lots of manual things you need to do. I still love counting on a hemocytometer for things like body fluids, things like that. Making blood smears, still pretty fun. That's something I still do every day. So microbiology and hematology are my favorites, and both lecture and clinical training wise.
So would you consider specializing, or are you happy maintaining your generalist license? What are your thoughts about that?
Do you mean specializing, like having a specialist license, or do you mean like the limited license for only being able to work in a department?
Yeah, if you would you ever consider just working in microbiology,
Oh, okay.
or what
I
do you?
see. I would consider both. I don't really have a major preference for either one. I think there's pros and cons to both. I really like right now being at Kaiser San Jose, having multiple departments to be able to go through. It keeps it exciting. I'm not doing the exact same thing every day. Switches it up a little bit. But at the same time, I think it's nice because everybody we met at regional lab where CLS is working in one single department, they were really knowledgeable on their one department that they were focused on. Like everybody in microbiology, they knew so many things. So many of the exceptions that happen because science isn't perfect. So you're perfect. Not every test is going to come out perfectly to one organism. So they knew so many different exceptions off the top of their head, and so I think there's I personally I have no preference to. I would consider doing either one, but it's up to you. What your personal preferences are.
I agree with you. Those folks who have specialized, I know one CLS who's in her 70s. She specialized in microbiology, and her knowledge is just, I mean, it's amazing. She's an encyclopedia of it. So
Mm-hmm.
I think with microbiology in particular, having that specialization and the many years of experience, it really lends yourself to being great at working in that department. But that's
Definitely. Yeah, we also have at work, we have our blood bank supervisor. He's also in his 70s. And just from looking at a panel, he can pretty much, once he starts seeing the reactions, he can already know which antibody it is before even doing more panels. Then when he does the more panels, because you still have to do the more panels, he was right pretty much every time. And yeah, really cool to see people who are really knowledgeable on one topic.
so. Speaking of that, do you find that a lot of your coworkers are older, or do you find that a lot of them are younger? What's the kind of age range that you see in the people who you work alongside?
It's honestly a mix. I've seen both. Most it's pretty much half where some of my coworkers are a lot of my coworkers are previous students at Kaiser San Jose, and there's a lot of young people in both labs, regional and Kaiser San Jose. It's pretty much half split with older people and younger people, not really predominantly one or the other.
Got
From
it.
what I've seen, at least, yeah.
So another question about just your experience going through the program. What advice would you have for kind of balancing that schedule of 4 days of training on site and having that one day where you're just focused on absorbing lecture material and I'm not sure, if you guys had an exam schedule with that, but how did that work for you? Was it doable? Did you find yourself having free time? And what advice do you have?
So for those of you who don't know, for San Jose State's program, on Mondays we had lectures at 10 a.m. or the videos would be posted at 10 a.m. And we would have weekly lecture exams that are due by Sunday at 4 p.m. You can do them earlier if you want to. So you have some freedom with how you want to, when you want to take the exam, how you want to study for it. Personally, what worked for me, it took a while to get used to it too. It was pretty overwhelming at first, but after a few weeks, I think the best advice for personally that worked for me, when my first watch through the lecture or during the live Zoom lecture, I would try to stay as focused as much as possible and really try to understand it the first time, because although not everything's going to stick the first time, I think that's the majority of the understanding came from. And then when I came back over the next few days to review the lectures, to review my notes, it was better to refresh my memory than having to learn things by myself. So personally, I think definitely pay attention the first time and then put in the work in the first time and then do review daily. So when I would come home from the clinical training, I would do some studying a little every day. I would maybe read through the lecture again, go through the slides, go through my notes a little by little every day. But yeah, not I try not to dump everything on one day, because that would be really exhausting. That happened, although it did happen a few weeks. It was pretty exhausting for that to happen. So just try to stay on top of everything. Go slowly, one one little thing at a time, a few slides at a time. Divide the lecture or something. But I never felt like I still have time to live my life a little, so I still got to see my friends. My expectation before starting, I thought, oh, this is going to be my whole life is going to be the CLS program. But it's actually pretty good it's a good work-life balance once you have the routine down.
Awesome. That's great to hear. I like to hear that. And that I think those tips that you shared too are really important. Also something we can take with us to use during undergrad as well. So now that you've completed your training and your licensed CLS, looking back at that time where you were learning so much, what were your biggest challenges with the training that you went through, and what was something that you just enjoyed most out of that time?
During the training portion?
Yeah.
I guess when compared to now working, or I'm still being trained right now again, to be able to do things, to be signed off on things to do on my own. But I really enjoyed how much time they really dedicated to actually teaching us versus, because at least for me, most of the trainers really had a passion for what they were doing, and they really wanted you. They knew that you're a student, you're a student first, and their goal is to help train you on this so that you can pass the ACP exam and be a CLS. So they really, I love the passion of them teaching. I love that the focus was on actually teaching us to learn versus teaching us to work. Because now that I'm working now, there's a bigger emphasis now on teaching us how to work as an employee, what to do with the rules on how to report things and things like that, protocols, SOPs, and everything. Versus during the training, they had more of an emphasis on reinforcing basically the lecture stuff, but with the clinical training, connecting those two. So I mean, I did the connecting, but they really focused on learning versus working now. Before, they'll actually teach me, RBC morphology, for example, or WBC morphology. And now, oh, this is what you should do when you report these results. When you're working now, there's an expectation that you know all this already, versus training, they're the ones giving you that information coming from nothing. So I think I enjoyed the learning aspect of the training as a trainee.
Got it. So now that you're working as a generalist, what is your day-to-day workflow like? When you arrive at work, what kind of tasks are you looking at for your day?
So right now I'm in the middle of my hematology training. But for the day-to-day, we would come in, there's you would pick up from where night shift is leaving off. If there's anything they need to tell you, they'll let you know. But it's pretty quiet when we come in. I come in at 6:30 a.m. right now. And then usually the morning round would come in about an hour or two. So there's time for you to settle into your station. During this downtime also, we have to do maintenance on the instruments. So for example, our hematology analyzer, we do a weekly and daily maintenance on that. We have a CellaVision, things like that. Basically, instrument maintenance is a thing you do daily, with a different one for a weekly basis. Other than that, for us, as specimens come, we throw them on an analyzer, get the results, make sure everything looks right for the patient, and then we verify the results. There's troubleshooting too. If the analyzer goes down, you need to figure out why and how to fix it. And that could go from you troubleshooting. It could go to you contacting technical support or support from the manufacturer. So it's a lot of different things, different tasks, maintenance, doing actual patient testing, troubleshooting. Yeah, that's a day-to-day, and all those things would happen mixed throughout the day. It's not a set. Try to do the maintenance during your time where you don't have any specimens, things like that. That's about it. It's not exactly the same every day.
That's good.
Yeah.
So do you feel like this work can get stressful for you during the day? Like, are there moments when you're getting a lot of stat testing that needs to be done and things get, kind of spicy in the lab? Or what's your stress looking like while you're doing this?
I think it gets really stressful when you have to get good at multitasking, because things will come up at the same time. You're going to suddenly get a high volume for things like the morning round, or you'll get maybe a critical value or something you need to call the nurse. All these things might happen at once. Or you might, let's say there's a high volume during the morning round and then your analyzer goes down. That's you start to get stressful. Nurses might start calling for results. Where's my result? And you have to explain that you're troubleshooting or the analyzer went down, or you might have to revert to backup methods. So, we do have a hematology analyzer for our primary, but we will still go to manual hemocytometer counts when necessary. So that's when it can get stressful, when things happen all at once. You have to keep your cool, know what to do, handle one things at a time, prioritize. Maybe if something goes down, get the stat specimens done first. So all that can get really stressful when things happen all at once. So it's good to be knowledgeable and know what to do at those moments. That watching that as a trainee was really helpful too when those things would happen. Trying to see how they would deal with everything happening all at once and how they would deal with the stressful situation. So that's the stress of a of a CLS when things are happening all at once.
Besides that, do you feel like at the end of the day, you can kind of leave that at the door? And do you feel like that's one of the benefits of this career? That, you just come back for your next shift and that's when you can start worrying about everything again? Or how do you feel like the work-life balance is and that aspect of it?
I think that's one of the biggest benefits is the lab can't go home with you. So definitely once I leave, I can't really do any work outside of the lab. I mean, the only thing sometimes I'd be curious if a patient's okay for something that I would maybe be left off on and had to pass on to the next shift. But for the most part, it's nice to be able to leave work at work, and it's a really great work-life balance. And I think everybody would say that about working as a CLS. Great work-life balance.
That's great. That's really good to hear. Do you get the sense that there is, I think you mentioned this previously, that there is a really big need for CLSs? And do you feel like people who are interested in becoming licensed, would they have a lot of job options once they complete their program? Or what are your thoughts on that?
So yes, you could definitely feel it. At least at San Jose, we've experienced some periods of short staffing. There are a lot of open positions at a point of time, which is good for us, for options. There were definitely lots of options for us. But you can definitely feel it in the lab. Sometimes they'd be really short. They'd be really busy. During your training, they might not be able to give you their full attention or their full time at some days when they're really short. So you can definitely feel the shortage. But it's good for us, as we're coming into this field. We do have many options. We had many shifts open at San Jose. On LinkedIn and stuff, I get a lot of messages from CLS job recruiters. So there's definitely a need and there's jobs everywhere for us. So it's a good time to get into the field right now during this shortage for us to fill the spots. So yes, there's many options available for us.
That's great. That's good news for anyone who's interested. So just to wrap up here, are there any other aspects of your overall experience that you want to share, or anything that you feel like is really important for aspiring CLSs to know?
I think it's a really great field. The work is hands-on. It's pretty exciting. You're not just stuck at a desk all day. There's always interesting patients you come across that even still you've never heard of, or you get the program can only cover so much. There's so many little exceptions that you'll run into. It's a really exciting career with a great work-life balance. Really good pay as well in California. So the career really has a bright future ahead of it, and it's a great time to join if you're thinking about it. I really encourage it for all of you guys. It's awesome.
Sweet. Thank you for that. Lots of knowledge. I'm going to look now to the questions that we had asked here. Megan, do you have any questions that you want to ask Adriel?
Oh yeah, I put a bunch of questions in the chat, so I could just ask them out loud. How early in advance did you apply to the program? Or if you applied in advance at all?
So there is a deadline. I think I applied. I don't really remember the top of my head. Maybe 2 months in advance, or maybe at San Jose State you send an email to get started on your application process.
Right.
They'll send you a
The
thing,
intent to
a Google
apply. Yeah.
intent to apply exactly, and they'll send you a spreadsheet to keep track of what you need to do, what you need to submit. So I gave myself, I think, a little over 2 months, and then I'm pretty sure I finished I finished my application within a month before the actual deadline, I think, or
Mhm.
a few weeks deadline. I didn't wait to the end. That's how early I applied.
And those 2 months that you were completing the application, like did that include getting your letters of rec, or did you do that like prior?
Getting my letters of rec. Most of mine came from work, so I did ask them. That was one of the first things I did while I was starting the application process. I already asked them for letters of recommendation. I told them when I need them by. I give them all information. They send letters of rec directly to the program, not through
Oh,
you.
okay.
So yeah, so I did that right at the beginning to give them time to write it, and to make sure I did have the people for it. So if you're applying, I would definitely do that. Make that one of the first things because that might take time for people to and send their letters of recommendation.
Cool. Sorry, I'm kind of laggy right now.
No worries.
Okay. And to both you and Michael Bowling, I was wondering how splitting off into either one of you can answer how splitting off into like a generalist to a specialized CLS or like vice versa work. How does that work?
What do you mean by splitting off into generalists?
Like how Michael Bowling said that first he was, I think, in hematology and then went back to generalist. Like how do you decide, or is it decided for you, like on what you want to do?
So
I could help with that if you'd
yeah,
like.
yeah, I think Michael.
Okay, well, my situation is that I was in a unique situation, and UCSF at the time offered a license just for one department. So I got my license only in hematology. I got the same pay as a CLS. I worked in a hematology laboratory just like a CLS. I just couldn't go somewhere like blood bank. So that's why they call it a limited license. It really is limiting. You can't go to all the different departments. If I was to do it over, I would have started with the generalist license for sure. So CLS is the generalist license. Something like a CHS, which could be clinical hematology scientist, or CMS. Those are some different licenses that you don't really have to worry about because there's not a lot out there, and SJSU doesn't offer it. I think related to that is, and I think it's a great question, is that, and excuse me, everyone, I'm really, really sick. Luckily not COVID, but I wanted to make sure I made it to this meeting. So there might be some coughing, sneezing, etc. But when people graduate, a lot of times people will say that you want to be a generalist. That way you can get all your skills in all the different departments, establish those generalist skills, decide what you want, and then go and specialize. I took a different path. I only worked in hematology, and there's some departments that are related to that, urinalysis, body fluids, things like that. But after I got my generalist license, I'm still only working in a hematology laboratory. That's because I love it so much. So some people will give you the advice that you should start out as a generalist and maintain those skills. And some people like to stay a generalist. It gives them a lot of flexibility because they'll be ready if there's a better job somewhere to jump right over there. For me personally, I'm more maybe idealistic. I would say when you graduate, follow your heart. If when you were training and you loved one department, I don't think there's anything wrong with just saying, you know what, I want to work at a large hospital where you have the opportunity just to work in one particular lab, such as blood bank or hematology, and that's what I'm going to go for. If you work at a smaller hospital, they tend to make you work in different areas, which is exactly what Adriel is doing. Just to wrap up, a great analogy would be that when Adriel went to regional, which is a gigantic send-out lab, everyone was specialized and only worked one particular subject. But when he went back to the hospital that he's currently at, he worked all the benches. So I hope that kind of gives everyone an idea of what's going on with that.
Great, thank you so much.
You're welcome.
And then my next question back to Adriel, I was gonna ask if you felt that the program was very rigorous in your experience, or you seem like really like on top of it academic, like split up your work, but like for your experience and like to others who maybe don't work in the same way as you, like would you say the program is very rigorous?
Oh, it was definitely rigorous, and I don't want to make it sound like I had zero problem with the with the program or the training at all. It was definitely rigorous, and I was not on
Okay.
top of it all the time. But it's definitely rigorous. It will require lots of focus and lots of time dedicated to it for studying, and just not even studying, making sure you're being healthy. You know, being able to get enough sleep to be able to even get to the training and then study afterwards. You know, so definitely rigorous and probably the most rigorous time of schooling of my life, probably. Having You're basically doing school and working full time, pretty much what it is.
Oh,
If
like you didn't
to
have
sum it
like a
up,
side part-time job type thing too?
I personally I did not. I quit my previous job beforehand. Although I know a few people who did keep a part time job, and props to them because I thought it was really rigorous. And my my partner at Kaiser San Jose, his name is Tuan. He actually had a part time job at the time. So I saw how that took a toll on him. So it's definitely a very rigorous to do that. So yes, the program's very rigorous, but it's doable. Our the program, you know, we have really good program outcomes, right, Michael? I think really high pass rates and everything. Everyone graduates. It's rigorous but doable
Okay,
when you put in the
good
work.
to know. Okay. And then my last question was, or well, I know you only been there for 3 weeks, but do you know what it'd be like if you did need time off from your job or like needed a sick day? Like how would that affect your own work or if it would impact other people's work as well?
I think this would depend on what type of hospital or what type of lab you're at versus which is why I think it's great that I had experiences at both a big lab, big specialized lab, and a small hospital lab. I would say that somewhere like Kaiser Regional Lab, where it's really big, when they're really well staffed over there. They have a lot of CLSs, so I think they have less of an impact if you have to take days off over there. Versus here at Kaiser San Jose, we're a little not as staffed as them, and it's there are some people who are per diem who come in and help when someone has a day off. But really, if you take a day off, someone will have to fill in its place.
Right.
Whether it be other coworkers picking up extra shifts, whether it be people who are per diem who take on shifts when needed. So it really depends on what type of lab. And but when you start working, if you need time off, you take that time off if you have it. It's your time off. That's not your job to worry about that portion. That's management's
That's
job
true.
to worry about.
Like depending on if it was like a big lab or like a small lab. I don't know, because I know a lot of people and me like to take some time for like mental health, and I wanted to be sure that like that's like even
Mm.
a possibility.
Yeah, so at Kaiser we have a few personal days that you can have off. Um I wouldn't say you really can take unless you have a lot of PTO. You know, starting off it's really hard, you know, lots of
Right,
seniority based things. So
definitely.
time off is definitely available for you. But in terms of like the exact time, maybe if you want an exact day for vacation or something, it might be harder when you're on UCLS and if you're at a small hospital. But you'll be able to take time off. You have time off, PTO, things like that.
Oh, thanks. That's all the questions I had. So thank you both for answering.
You're welcome.
Yes, no problem.
Do we have any other questions? It looks like we have all the chat questions answered, but if there's anyone else who'd like to ask a question before we sign off, can do that now. Okay. Well, I think we can end a little early. Oh, we have a question here.
Oh, I see. So the question, I saw the question in the chat. Were the training shift set or did you have to be in different shifts? That would depend on your clinical site. At Kaiser San Jose, we only trained on day shift. So start in the morning, end of the afternoon. At regional lab in Kaiser Regional Lab, we did have a few weeks where we went on the swing shift, the PM shift. So we came in the afternoon and left. So came in about around 3 p.m. and left around 11 p.m. So that was a really cool experience to have a few, some training on a different shift, see a different lab environment. It's really different between day shift and PM shift, and I would assume night shift too is really different. Oh, my position, I'm actually going to be night shift for working. I'm training on days right now, but yeah, training we did depends on your clinical side, but I had experience with a little bit in PM shift.
Oh, sorry, I just came up with another question. Do you work like, is CLS like a 9 to 5 thing, like on the weekdays, or is it like weekends? Like, is it required all around? Like, how does it work? Because I know at the hospital I work at now, like I work in the image library, which is like in radiology, and we have like one department that I work in that's open 24/7, and then like a other department that's like in the same category that only works the weekdays. Like, is that a similar thing or?
So that also depends on the lab. There's a lot of things that depending on the facility. So at Kaiser Regional Lab, some departments were only day shift, some departments were only PM shift. Some departments were 24/7. So for like mycology and AFB, that was a day shift thing at Kaiser Regional Lab. So there was only a day shift for that. So that was versus here at Kaiser San Jose, the clinical lab at a hospital lab, and I was seeing more hospital. All hospitals are 24-hour labs with days, PMs, and nights. Maybe not for all departments, but for yeah, it depends on the facility, and also depends on the facility, your days too. At Kaiser Regional Lab, the CLSs over there, they had set schedules. Versus here at Kaiser San Jose, your days off will vary depending on the week. So really it depends on the facility. Yeah. No problem.
Any other questions for Adriel while we have him? Thank you so much, Adriel. Thank you for sharing all that information with us and sharing your experience and for sharing your time with us too. We really appreciate it. And thank you for being our first guest speaker. It's so exciting. We really
No problem.
It was great to hear from you. Thanks also to Michael for being here despite being sick, and thank you all for attending. So we have another upcoming event on Saturday from 2 to 3 with another recent graduate from San Jose State's program, a friend of Adriel's, and her name is Alana. And we hope to see you guys then. And thanks so much. Hope you guys have a good night. Take care.
Thanks, Marty. This is awesome. Great to see you again, Michael.
You too.
Yeah. If you guys have any questions, you can just add me on LinkedIn and you just message me.